Hi, my name is Daniel Ray. I'm Director of Informatics and Patient Administration here at University Hospitals Birmingham Foundation Trust. There's a couple of things that I'm going to talk about today. One is following the publication of the white paper and the attached documentation around that with regard to an information revolution liberating the NHS. There's two things in there that really caught my eye. One, I think, is about the importance of being able to link data together. On a previous video diary I talked about Quality and Outcomes Research Unit that we launched at the Trust. One of the most important things around gathering data and as part of this information revolution that's been talked about is the ability to be able to link it together. Of the 360 plus quality metrics that our clinicians have developed in this hospital, only I'd say about 20 or so of them actually use a single isolated data set. All of the other metrics, the 360 plus, require linkage of data. So you've got the core national inpatient data set that's submitted to HES that all the hospitals collect. Only a very small number actually come off that one data set. What clinicians feel are important and the metrics are associated with assessing quality of care involves linkage to lab systems, e-prescribing solutions and a number of other databases. So I just can't emphasise enough the importance of being able to link data together. The second point is around the identification and requesting a named consultant with regard to surgery, which has been talked about a lot in this paper, and the ability to be able to choose and identify a named consultant. That's an interesting concept, and one that begs the question, I feel, is on what basis are patients going to make these decisions? On what information that's going to be made available are they going to make these decisions? That's the real big question that I think that we need to get into when considering that. And also some consultant teams are operating which provide cross cover for one another, and it can be argued that that's just as important to ensure that that happens rather than just identifying and naming a single individual. So it's an interesting concept to give patients the ability to be able to do that, and that's what is stated in the paper. But then the next steps that follow on, certainly in my profession, and what we're going to have to grapple with is what types of relevant and important information are going to be made available to patients that over and above what we already make available, that's going to enable them to make these decisions. So that's quite interesting.